Welcome. This is Dr. Bodendorfer, and this is a guide to prepare for and recover from shoulder replacement. I'm an orthopedic surgeon specializing in both sports medicine and shoulder surgery. My personal website, omahasportsdoc.com, has a ton of useful information on it if you would like to learn more. So why are you here? I want you to have a game plan for getting healthy and ready for surgery. This will help you recover faster. I also want you to anticipate your expectations for returning home, driving, and returning to work, as well as to learn safe ways to do everyday activities. I've prepared a booklet on everything and more than what will be covered in this video today. In the video today, you will find steps for preparing for surgery, out-of-work expectations, what to bring to surgery, surgical precautions, ways to prevent infection, and how to care for your surgical wound, how to use your sling, how to best manage your pain, and video instructions on how to change clothes. Our goal is to get you home safely. We know that patients who leave the hospital sooner have fewer complications, are less likely to be readmitted to the hospital, and have a quicker recovery. One important way to prepare for surgery is to stop smoking. This will speed up your recovery, prevent breathing complications, lower your chance of developing an infection, and even reduce your pain after surgery. Taking care of your teeth and skin is important to prevent infection. Brushing twice daily and flossing daily can also help. We will ask you to check in with your dentist prior to surgery to ensure there are no issues with your teeth or gums. If you have any wounds, please let me know prior to surgery. Nutrition and hydration are also vital to your success. A good diet helps with healing, and I prefer well-balanced and low-carb options. Make sure to stay hydrated by drinking at least 6 glasses of water per day. Getting as healthy as possible prior to surgery is also important. Patients with diabetes will need an A1C under 8 to safely proceed with surgery to prevent infection. It's important to have plenty of support before and after surgery. You will need to check in with your primary care provider, your dentist, and potentially specialists depending on medical conditions. On the day of surgery, you will need a family member, friend, or caretaker with you. If you are a candidate for same-day surgery or going home the same day of surgery, someone will need to stay with you for at least the first night to help with tasks. You will likely need extra help at home for the first 2 to 4 weeks after surgery as you adjust and recover. It's important to prepare your home to allow for ideal recovery after surgery. Grocery shopping, meal preparation, and prescription refill should be tended to prior to surgery. You should consider how laundry, dishes, and cleaning will be accomplished. Patients often prefer to sleep in a recliner or in bed with a ramp or several pillows behind them for support after shoulder replacement. A shower chair and raised toilet seat may also be beneficial. Tripping hazards like throw rug should be cleared or removed from walkways to prevent falls. Anti-slip mats can be purchased to prevent falls as well. Any loose cords or cables should be secured or tucked away. You'll want to arrange furniture to maximize space of walkways and have a cell phone nearby in case of emergencies. 2 to 4 weeks before surgery, you should have your preoperative appointment with your primary care provider to review medications, your medical history, and lab testing, EKG, and chest x-ray will be ordered. You will also want to start practicing daily tasks with your non-surgical hands, such as using the toilet, bathing, and dressing. Easy open pill box, floss pick, easy pump bottles for the shower, and reacher devices can all be helpful in early recovery. 1 week prior to surgery, you will want to start packing your bag. A loose-fitting t-shirt and shorts or pants with waistbands and shoes with closed backs to prevent slipping are all recommended. If you use a walker or a cane, you'll want to bring this. If you plan on staying in the hospital the night of surgery, bring your toiletries, contact lenses or glasses, CPAP machine if you use one, and comfort items like crossword puzzles, magazines, earplugs, sleep mask, or pillow. You'll want to bring your insurance card and ID card to the hospital or surgery center. Make sure to sleep in clean clothes and sheets leading up to surgery. As a reminder, if you have any wounds, please bring this to my office's attention. Generally speaking, 1 week before surgery, you will need to stop taking aspirin and other anti-inflammatories, such as ibuprofen, Motrin, Advil, naproxen, Aleve, diclofenac, Voltaren, meloxicam, Mobic, as well as blood thinners, unless directed by your primary care physician or specialist. Topical anti-inflammatories and oral Tylenol or acetaminophen are okay to take. Usually one day before surgery, a nurse will call you to confirm your surgery and arrival time. You'll need to shower following instructions given to you using a kit. Remove all jewelry, including rings, earrings, and piercings. Make sure to finish packing your bag with the essentials and avoid sleeping with pets the night before surgery. Remember to follow instructions on when to stop taking certain medications and when to stop eating and drinking, typically at midnight. The morning of surgery, you will need to shower again following the instructions provided to you. Remember to arrive on time or early the day of surgery to prevent any delays. Once you arrive to the hospital, a nurse and the anesthesia team will prepare you for surgery. Your friend, family member, or caretaker may wait in the waiting room during surgery. If your surgery is at the hospital, you can track progress of the surgery on the tracking board. Immediately following surgery, you will go to a recovery room prior to going to your hospital room or continue your recovery prior to going home. The next morning, the nurses will monitor your vitals and ensure that your pain is controlled. You may be fit with an ice machine or cold therapy unit, which helps significantly with swelling and pain. But remember, your nerve block typically wears off 12 to 24 hours after surgery. When you begin to feel your fingertips, taking pain medication before you have any pain will prevent a sudden rush of pain from occurring. The next morning, get out of bed or your recliner as soon as you can. Eat a nutritious breakfast and review your surgical precautions. Remember that your new joint needs time to heal, and this can take up to 6 weeks. You should not move your shoulder on your own until you are cleared to do so by me. I will have you perform pendulum exercises, more on these later, hand, wrist, and elbow range of motion exercises, and grip strengthening exercises 3 times per day for 5 minutes each. Do not reach or lift for objects that make your elbow leave its side. You should use your other arm for most activities. Generally, you will not be permitted to drive until you are out of your sling at about 4 weeks after surgery. You'll not be permitted to push, pull, or reach with your operative arm for the first 2 weeks. You can eat, drink, gently wash your hair, and brush your teeth using your arm, however. You may lift and carry light objects such as a glass of water, cell phone, toothbrush, or TV remote. To prevent pain, avoid sleeping or leaning on your shoulder replacement. Running, jumping, and jarring or jerking activities such as mowing the lawn or gardening are not permitted immediately after surgery. You'll need to hold off on swimming and getting in hot tubs or saunas until your wound is healed and cleared by me. Aerobics and exercise classes, for the most part, will also require clearance by me once your shoulder is healed. You should avoid treadmills, ellipticals, and stair climbers until at least 6 weeks after surgery. Activities that are okay to perform immediately after surgery are walking, stationary biking, using your feet only and not your operative arm for support, and shopping. Make sure to rest frequently when performing these activities. Typing and writing are okay, and you may remove your sling for this so long as your arm and wrist are supported. Turning pages of books and newspapers are safe, and so is cutting food with your elbow at your side. The morning after surgery, make sure to get dressed and adjust your sling to a comfortable position. You should wear your sling continuously and while sleeping. You may remove your sling to shower or get dressed. So how long will you be in your sling? Well, every shoulder is different. Generally, I recommend using your sling 24 hours per day for the first 2 weeks, except for when you are showering or changing your clothes. 2 weeks after surgery, you may remove your sling for sleep, and generally you will not require your sling longer than 4 weeks after surgery unless you would like to wear it in busier environments, such as at the grocery store or at family gatherings. More complicated shoulder replacements may require slings for longer than 4 weeks total.
Let's talk about getting that sling on and off and getting dressed and undressed. First, we're going to start with an oversized button-up or zip-up shirts, which can be purchased at a local flea market. Start by draping it over that affected right side. In this case, we'll be using the right shoulder. being cautious not to move that right shoulder. And you may need assistance to button and zip the shirt or coat. And taking off the clothing, we start with that left side. And the right. Now removing the sling. Pull open the Velcro with that left side, being careful not to let that right arm dangle. Use your body to secure that right arm against it. And getting dressed in a pullover shirt. As a side note for females, we recommend using a front closure bra. Improved comfort and also for ease. So getting a pull-on shirt, affected side first, over the head, and then that left side goes in. Again, being cautious not to move that surgery side. Pull the garment down. And putting the sling back on. Whenever possible, we want to use that left side to help raise that, use the left side to help raise that right forearm. So we're not actively using those muscles. We make sure that the elbow is right in that nook of the sling, nice and snug and secure. We wrap the band around and we secure it with the strapping. And that's it.
I use a waterproof bandage that stays in place until I see you at your first post-operative appointment. You can shower with the bandage, but do not submerge it, such as in the bath. If the bandage needs to be removed for any reason, do not use ointments or lotions on the incision, and place a new bandage over the incision. Remember to eat healthy, stay hydrated, and avoid smoking, and take your pain medication with food to prevent stomach upset. Tips to help with pain are relaxing your arm by allowing the sling to support it. A small rolled towel or pillow behind the arm may help with your comfort. Remember to keep your elbow at your side rather than across your body. Remember to take your pain medication as I prescribed it. The earlier you can wean off of them, the faster your recovery will be. You can begin to take Tylenol or acetaminophen in place of the stronger pain medication. I'd like you to use your ice machine or ice packs for 15 to 20 minutes every hour to help with swelling and pain. Therapy or nurses will reinforce home exercises specific to your surgery before you leave the hospital or the surgery center. Remember to do these 3 times per day, keeping your arm relaxed. Exercises may be hard, but should only cause mild discomfort at most. Pendulum exercises are performed by leaning over and using your opposite arm for balance out of your sling. Use your body rather than your arm to dangle your arm and rotate it 10 times clockwise and 10 times counterclockwise, 3 times per day. Remember to stretch your neck out, work on grip strengthening with a squeeze ball by holding it for 2 to 3 seconds, and straighten and bend your elbow, all 10 times in a row after your pendulum exercises. Also, squeeze your shoulder blades together, extend your upper back, flex and extend your wrist, and rotate your wrist and forearm 10 times in a row as well. Generally, formal therapy will start after I see you at your first post-operative appointment, but some patients are candidates for home exercises alone. On average, patients are about 60 to 70% recovered by 6 weeks after surgery, 80 to 90% recovered by 3 months after surgery, and reach full recovery between 6 and 12 months after surgery. Some high-impact activities should be avoided even after full recovery, such as contact football, rugby, and wrestling. Hiking, jogging, biking, and golf are usually allowed, and typically patients can do this 5 to 7 months after surgery. You should follow up with me in the office 10 to 14 days after surgery. We will check your wound, remove your staples or stitches, and give instructions for exercises and activity. When you can return to work really depends on your job. For instance, a desk job or supervisory role will allow you to return to work as soon as 2 to 3 days after surgery. Jobs that require heavy lifting will require longer periods of downtime and will be reviewed on a case-by-case basis by my team. There are some things that you should avoid doing after surgery unless specifically cleared by me. These include activities that cause sudden jarring, impact, or force across the joint replacement, such as chopping wood and driving fence posts. Contact sports such as football, rugby, and wrestling should also be avoided. You should not lift objects heavier than what you can comfortably lift 15 to 20 times in a row. Generally, I ask that you do not lift anything heavier than 25 pounds over the level of your shoulder using only your shoulder replacement arm, but you may lift objects heavier than this over your shoulder if both of your arms are used. If you have any more questions, please do not hesitate to ask by calling any of the office numbers listed here. Have a great day, and I look forward to taking care of you.